South Florida today on NBC6 HD.
Sherry, over to you.
Okay, do you find yourself squinting when you read or maybe rubbing your eyes a little too much? Well, eyesight changes over time, and tuning into those changes can actually help you prevent future problems. We have Dr. Trattler here with the do's and don'ts of eye care. And I guess we can start with what you're doing when you're younger and work our way up to maybe some of the older problems that you see as well.
Absolutely. The key thing is, one thing is not to vigorously rub your eyes with your knuckles. That can be a real problem. So with your knuckles, digging into your eyes.
I thought that was cleaner. I figured my fingertips were dirty, so I've always used my knuckles, but that's a big no-no.
That's a big no-no, right? The force can cause warping of the cornea. That can lead to a condition called keratoconus. And if you have keratoconus, you lose your ability to see. Your vision's blurry, and you can only see with contact lenses. Okay. Glasses just don't work.
And that probably goes for people of all ages, then.
It does, but especially when you're younger. Thankfully, we have a new treatment called crosslinking, which we can now take patients that develop keratoconus and treat them and stop it from getting worse. But the key thing is preventing it. If you see your kids or young adults digging in, you want to get them to stop.
Well, I suppose with kids too, maybe it's a sign that they have allergies or something. You know, you could always go see the doctor or the eye doctor.
There you go, exactly. And we have great treatments for eye allergies for kids. So.
Oh, very nice.
Yes.
All right, so that's something that would probably fall into the 20s category, right?
That can, exactly.
Or any age.
Any age, exactly.
Now, you've got to tell me that studying and staring at computers and textbooks all day long must do some damage. I remember having very blurry eyesight after spending nights studying and studying.
You're absolutely correct. There's a condition called computer vision syndrome. So computer vision syndrome is where you stare at the computer and you don't blink enough. And it's a reduced blink rate causes burning of the eyes, you have burning sensation, foreign body sensation, and the vision becomes blurry. Yeah. And it's due to lack of blinking, and so you get evaporation of the tears.
Now, is that something that always reverses when you look away from the computer, or is that something that gets progressively worse?
Right, it can get progressively worse, but if you take a break or put artificial tears, like artificial tears in your eyes, that can help relieve the symptoms.
Actually, I had a question about the artificial tears. You know, you see so many of these, you can get a prescription from you, or you can go to just the drugstore and buy eye drops. Is there any downfall to using eye drops often? Is there any reason why people shouldn't be using them frequently?
No, there's really not. If you're having symptoms, eye drops are great. They can really help. But if you're using eye drops frequently, you might want to see your eye doctor and talk about prescription drops like Restasis or other medications to try to really treat the underlying cause of dry eye.
Okay, and what age group do people usually end up needing Restasis?
Well, Restasis, I've treated patients in their teens and 20s, but usually, you know, as we get into our 30s, 40s, and 50s, it's very common. Often contact lens wearers, people who spend all day in contacts, can be very irritating and lead to dry eye. So Restasis can be a great treatment for those patients.
Okay, and I read in the notes as well something about hormone changes in affecting your eyesight.
I mean, hormones, again...
Can we catch a break?
There you go, exactly. For some reason, females are at higher risk for developing dry eye, so we just see dry eye more commonly. And again, the key is to treat the underlying cause and treat it early rather than waiting until it gets really bad. Okay,
and lastly, I wanted to point out here the importance of sunglasses, right?
Absolutely. So here in South Florida, we have lots of UV exposure, so wearing sunglasses with UVA and UV protection is very important to help protect the eyes. Okay, well, if you want to see Dr. Trattler, you can always make an appointment with him for more information on how to maintain healthy vision. You can call 305-598-2020 or go to centerforeyecare.com. All right, Nathalie, over to you.